All right, we're going to look at some things that are here currently and some stuff that's in the pipeline that may impact EMS care delivery and what you do on a daily basis. So I'm entitling this EMS Back to the Future. All right, the first thing we're going to talk about is something that a lot of people may have seen recently. It seemed to explode on Facebook, but this is an injectable series of sponges that you put into a penetrating trauma wound or otherwise some type of a deep wound that you can't easily apply direct pressure or tourniquet to. These sponges then expand, and encoded with the sponges are elements that cause clotting to happen. So this, as the sponge expands, it gives a pressure, direct pressure to the bleeding site, as well as actual hemostasis. So that is in current development and something that we may see in the not too distant future. Along the same lines is this abdominal foam. So if you've got liver laceration, spleen lacerations, internal bleeding that, again, you can't put direct pressure on, you can't get control of, here's something you can stick this trocar in and it expands this foam and allows for some direct pressure. Here's a little quick video showing a kind of a demonstration of what it might be like.
The Arsenal foam technology has been engineered to treat life-threatening, non-compressible abdominal trauma. This product, shown here treating an acute liver injury, is injected as two liquid phases. Upon mixing, a chemical reaction is initiated, causing the material to expand throughout the abdominal cavity, making contact with sites of injury and creating a tamponade effect to stop bleeding. The product molds to the anatomy, allowing injured patients to be transported to surgical care where it can be removed.
Now imagine if you put that foam along with some stuff that allows hemostasis. All right. Here's a computer chip. The interesting about this computer chip is it's wearable. So there are now devices being created that are embedded into clothes or other things that contact the human body and provide information. Those of you that may be into running or other types of things, there are things that you can wear in terms of like a watch or a band that will give heart rate and other physiologic data. So imagine being able to slap something like this on a patient, and again, these exist currently, but it's mostly in the fitness industry. And then you've got an iPad where you can then monitor multiple patients at once. So you roll up on a mass casualty incident, throw these on, and you can kind of see who's doing what in terms of their pulse rates or some other impedance data, maybe even blood pressure. So I think this is an up-and-coming technology that we'll see arrive in the EMS field. Here's video laryngoscopy. This exists today. We've been using this in the emergency department for a number of years, and I know this is entering into the realm of EMS. I know it's on several ambulances, and this is something that I think is a great tool, and it's something that we should move forward on in the EMS world as fast as possible. This gives great visualization of the cords. You can actually see it go in. You don't have to manipulate the neck if you're worried about C-spine precautions. So this is a great tool. All right, here's a ventilator. This is being used in the military with the critical care air transport teams on the back of giant planes that are basically flying ICUs. So this is about the size of an IV infusion pump, and this is a fully functioning ventilator. It's powered through oxygen. An amazing device, low energy consumption, long battery life. It can do just about everything that a normal ventilator can do. So again, I think that's something that's here currently and may move from the realm of the military into the private EMS setting. All right, here's something else that's pretty cool. Say you got bonked in the head, you got a brain bleed, somebody's got altered mental consciousness, altered level of consciousness. You're not really sure, are they just whacked? Have they taken bath salts? Are they drunk? Or do they have a head bleed? Well, this device right here, you could put onto the head, and it doesn't have any needles, it doesn't go through the brain or anything like that, but it will help detect and see if there's any brain bleeding.
I'm Dr. Joseph Maroon, and I've been the team neurosurgeon for the Pittsburgh Steelers for many years. The InfoScanner is a handheld, lightweight system. It uses near-infrared technology to detect intracranial bleeding. It provides a simple positive-negative report that helps to identify those patients who may need immediate referral for for a CAT scan and or neurosurgical evaluation.
All right. So in the same vein of looking inside the body, ultrasounds are being developed that are very small and portable. They're already about the size of a laptop, and here's one that GE produces that's um, the size of maybe a 1990s cell phone, one of the big kind of clunky cell phones, but you can use this to do ultrasound scans. So imagine doing a fast scan, and we could teach people to do fast scans very easily. It's not a difficult skill to learn. You just put the probe on 4 different areas, and you look to see is there blood inside the abdomen. And if the hospital can get advance notice that you have a positive fast scan, that means we're already calling the OR crew in. We're already getting our blood ready. We're doing those things in preparation, knowing that this patient has a very high chance of going for exploratory laparotomy. All right, here's what you look for. The liver's labeled, the kidney's labeled, and then there's something called Morrison's pouch, which is a space if you fill it with blood, but otherwise the kidney touches the liver. There's no black fluid in between the liver and the kidney, so they touch each other. That's normal. Now, if you've got a significant amount of blood in the belly, here you can see the liver's labeled, the kidney's labeled, and that black area is a fluid collection, which is blood. So you see that, you see the kidney pushed away from the liver, then that's evidence that you've got significant intra-abdominal hemorrhage. Here's another picture. Again, the liver's on top, the kidney's below, and it's separated by that fluid collection. That is a positive fast scan right there. All right, there's point of care blood test. All right, now, does the EMS community really need to be doing electrolyte panels and all kinds of craziness? Probably not. There may be a few instances where it's indicated, but I think where this becomes important is in our really sick patients that we're resuscitating, and if you can get a quick lactate level, lactate can give you a really good idea of tissue perfusion. You've got an elevated lactate that can help guide and direct some of our resuscitative efforts. So I think this is something that we'll see, again, within the next few years develop and come into the EMS world. All right, now there's other types of devices. This is a Google Glass, which projects a computer image into the eye, under the retina, so you basically see a floating computer screen. And so things like this can be used for a whole variety of stuff in terms of scene management or interfacing with the receiving hospital, or perhaps you threw those little devices on the wrist of several patients and you're monitoring their pulse and breathing using this Google Glass. Here's what this looks like.
Here are the basics of how to use glass. This is your touchpad. It runs from your temple to your ear. Tap the touchpad to wake up glass. You should see the display above your line of sight. Adjust it to see everything. The home screen shows a clock. This is your timeline. It's a row of cards. Things to the left are happening now.
You kind of get the idea of what that's like.
An upcoming flight.
Now just imagine projecting that into something that contains patient data or allows you to speak directly to a physician. So I know people are working on medical applications of Google Glass. I know physicians have already performed surgeries wearing Google Glass and transmitting that so people in remote areas could watch the surgery and learn. But I think this will be another area of rapid involvement. All right, here's Amazon Prime delivering your package using a drone. This was on 60 Minutes, caused a big splash. But Amazon's not the only one looking at drones. Here is a drone being developed in Israel with the express purpose of going and picking up a patient and transporting them in an unmanned craft. So if you've got somebody in an area that's perhaps too dangerous to get into with humans, there's active fire or chemicals or hydrogen sulfide gas or something caustic, you could send this in, pick the patient up and extricate them and bring them to a treatment area. So that's currently in development, and this is a live test in Israel. All right, so that's a quick overview of what may be coming with EMS. Some of the stuff, like I said, is perhaps more sooner than later, and other stuff we'll have to wait and see if it comes to full fruition. But anyways, thanks for this peek into the future.